I know just hearing the word Medicare is enough to give you a headache. You probably heard so many different opinions from people around you, yet no one seems to give you straight answers that fits your situation. It's frustrating, right? That's exactly why I'm here. Welcome to PARKssam's Medicare 101. Simple summary. Let's put away the confusing jargon and those thick handbooks for a moment. In just 15 minutes, I'm going to strip everything down to the core essential you need to protect your retirement. If you stay focusing on this one video today, I guarantee you won't lose your hard-earned money due to Medicare mistake. Are you ready for clear, no nonsense Medicare lesson? Let's dive in. Thank you so much for your time and for trusting me with your healthcare journey. I am Min Park, better known as PARKssam. I'm part of Health Markets, a major national brokerage, and I'm currently hold licenses in 16 major states across the country, including, of course, Arizona. If you thought I was just here to compare insurance plans, you are in for a surprise. I am certified RSSA, a Registered Social Security Analysis. Why does this matter? Because Medicare and Social Security are deeply connected, and you can't fully optimize one without the other. My philosophy is simple. I'm not just selling insurance. I'm design understanding. I'm here to be a partner in protecting you lifelong retirement assets. Through this 15 minutes guide, you will see exactly why so many people choose to design their retirement years with me. Let's get started. Now, let me share a simple analogy to show you how I protect your future. Imagine your retirement as a three-leg stool for you to sit comfortably and securely. All three legs must be equally strong. Even if one leg breaks, the whole stool falls over. Let's look at how I help you build and strengthen these three legs. The first leg of our stool is health protection. Think of this as your primary shield standing right between you and the unpredictable nature of life and death. Its job is to let you focus purely on recovery without the crushing weight of worry about hospital or doctor's bill. Depending on your specific health needs and budget, this right answer might be original Medicare or it might be Medicare Advantage plan. There is no one size fits all here. That's why in a moment, I'm going to put these options on a microscope and analyze them for you so you can find the perfect shield for your life. Now, the second leg of our stool is income and asset protection. To be honest, this is where the real strategy happens. If the first leg is about paying doctors, this second leg is about stopping the bleeding from your own pocket. Imagine your hospital bills are covered, but then a separate invoice for thousands or even tens of thousands of dollars arise. If the bill starts draining your retirement saving, then your income isn't truly protected. This is where we look at tools like Medicare Supplement, so-called Medigap, or maybe Medicare Guard Plan or Accident Indemnity Plan. These act as a safety nets to ensure your hard-earned assets don't crumble away due to unexpected out-of-pocket costs. I will dive much deeper into these specific asset saving plans in the separate session. But for now, remember, the second leg is the guard for your wallet. Now, third leg is family protection. This is what protects your loved ones from the burden of long-term care or financial impact if you are no longer there to provide for them. It involves things like life insurance and long-term care planning. Well, now everyone, I have to be very honest with you. Due to strict legal regulation regarding Medicare consultations, I am not here to permit to talk about these details of third leg during our session today. However, we all know that if even one leg is missing, the stool will eventually tilt. Your family peace of mind is too important to leave that chance. So once we finish our meeting today, Let's schedule a separate time to sit down. At that time, I can show you exactly how to build a sturdy protection for your family future. This is the backbone of Medicare. You only need to know these four parts, and I will break them down into simplest way possible. Part A, hospital insurance, the laying down insurance. Simply put, this is for when you are laying down in the hospital bed due to major illness. Part A takes care of those massive hospital bills when you are admitted for surgery or inpatient care. Part B is medical insurance, the walk-in insurance. This is what you use when you walk into a facility. It covers all outpatient services such as seeing a doctor, getting lab tests, or receiving injections. Together, Part A and Part B are called original Medicare. Part C, the Medicare Advantage, the all-in-one package. Think of this as all-in-one package insurance. The private insurance company gets authority from the government to bundle this Part A, Part B, and usually Part D, the drug coverage, all into single plan. Part D, the drug coverage, the pharmacy insurance. Literally, this is insurance that discounts your cost when you buy medicine at the pharmacy. In Medicare, there are two main paths you can take. Together, we will explore these roads, the best fit for your specific needs. However, understanding basic now will help you ask more specific and informed questions during our consultation. Your two choices are option one, the original Medicare, Part A and Part B, and standalone Part D, a drug plan. Option two is Medicare Advantage, also called Part C. Think of this as a fork in the road. Both paths leads to coverage, but they function very differently. My goal is to protect you towards one that gives you the most peace of mind. Let's take a look at in details. Let's look at lane one, the original Medicare path. In this lane, you manage Part A, Part B, and your Part D, the drug plan, separately. But here is reality. Medicare is not 100% coverage. There are costs you must pay out of your own pocket. Part A hospital, you have $1,000, $736 deductible for hospital stays in 2026, while most people don't pay a monthly premium if they've worked for 10 years or having 40 credits, the deductible still applies. Part B, the medical insurance, you pay $202.90 premium for 2026, Part B standard premium. You have also $283 deductible. After that, you are responsible for 20% of coinsurance. And here's the scary part. There is no limit on that 20%. So if your bill is $100,000, you pay $20,000. If it is $1 million, then you pay $200,000. That's massive hole in your safety net. Part D, as a drugs, I strongly recommend to signing it up for even a basic plan early. If you delay, Medicare will charge you for late enrollment penalty, 1% per month, meaning you will pay more for your premium for the rest of your life than anyone else. Remember my 3-leg stool? Having only original Medicare is like sitting on a stool with only one leg. Your health might have a shield, but your income and assets are completely exposed. The chair could tip over at any moment. To fix that missing leg and protect your wallet, there is a solution. Medigap, also known as a Medicare supplement plan. By paying a monthly premium to the private insurance company, that company steps in to pay what Medicare doesn't. They cover your Part A hospital deductible and, most importantly, that terrifying 20% co-insurance from Part B. Think back of my three-leg stool. When you add the Medigap, you finally complete the second leg, income and asset protection. You are creating barrier that stops your hard-earned savings from leaking out every time you see a doctor. This is a complete lane one. A sturdy stool with the two strong legs that keeps your assets safe and your health covered. No more worry about surprise bills in the mail. Now, you might be wondering, is there a way to get those two legs bundled together from the get-go? Yes, there is. And that's what we call lane two. Let's check it out. Now, let's look at lane two. Medicare Advantage Part C. If lane one was about managing everything separately, lane two is all in one bundle. This lane, private insurance companies take over for the government. Instead of carrying multiple cards, you just need this one single insurance card. It bundles together Part A, hospital, Part B, the doctor, and usually Part D, the drug. You are essentially choosing private alternative to original Medicare. Think back to my three-leg stool. Lane 2 combines the first and the second leg into one thick, sturdy support. Unlike Lane 1, where you pay high monthly premium for Medigap, many Advantage plans have a $0 monthly premium. You pay as you go with a small copays. But here is the critical safety feature. Lane 2 comes with an out-of-pocket maximum. This is a cap on how much you can pay in the year. No matter how sick you are, once you hit that limit, the insurance pays 100%. This is the second leg protecting your income and assets built right into the card. Plus, you get bonus features like regional Medicare doesn't, like dental, vision, hearing, and even fitness membership. It's very popular choice for many modern seniors. So, which path is better? Well, separate protection for number one or all-in-one smart of lane two. There's no single right answer, but I am here to help you to find the one that fits you the most. All right, everyone, let's wrap this up with a clear summary to help you decide which path is yours. First, lane one, the original Medicare and Medigap path. The biggest advantage here is freedom. You can see any doctor in US who accepts Medicare. No referrals needed, no waiting for prior authorization. If you prefer to pay a set premium each month so you never have to worry about hospital costs or network restrictions, this is the best choice. Downsides? Well, the monthly premiums are higher and you need to handle dental vision coverage separately. Now, lane 2, the Advantage plan. This path is a champion of value and convenience. Most plans have a $0 monthly premium, which keeps more money in your pocket. Plus, it's all in one card. Drug, dental, vision, it's all there. Trade-off? Well, you must follow the rules. You generally have to stay within the network doctors and the hospital. Insurance company limits your health options. And for major procedure, you might need wait for insurance approval. Using the stool analogy, think of it this way. Lane 1 is a custom-made stool using most expensive high-end materials for each leg. Lane 2 is modern, high-tech, all-in-one chair that offers great value. So which one is better? It truly depends on your health and your lifestyle. And that's why I'm here. I'm an expert who will take those pros and cons and apply them into your life to find the perfect fit. Don't worry, during our meeting, I will help you to pick the customized chair that's just right for you. Now, the choice is yours, but don't feel overwhelmed. I'm here to hold your hands every step of the way. If you haven't scheduled your 15 minutes consultation with me yet, please use the link below to book a time that works for you. I will personally inspect your three-leg stools to make sure it's sturdy enough for your retirement. And I have something very special for you. PARKssam Knowledge Vault. This is a digital library. I've collected detailed videos on the hidden secrets of Part A, Part B, and Medigap that we didn't cover today. For my free membership subscriber, you can even take a self-test. Once you pass quizzes and earn your Medicare Master badges, you will basically be an expert yourself by the time we have our consultation. If you study in the vault before we met, I can provide you much deeper and more customized strategy. So go ahead, book your session now, and I will see you in the Knowledge Vault. I am your reliable retirement partner, PARKssam here.